Right now is the time, his bones are being formed, his blood is being made, and his senses are being developed. To him, we cannot answer tomorrow. His name is today. As is the very definition of the child, so is the disease, childhood glaucoma. It's an urgency, it's an urgent medical attention or surgical attention is required for each and every afflicted child. The message to be sent to the community is that early detection, prompt evaluation and early surgical intervention is the key. And along with that, an integrated approach of medical, surgical, genetic and rehabilitation approaches. One important concern which has to be conveyed to the community is effect of or concern about the genetics. Sometimes consanguineous marriage, maternal uncle to niece marriage, cousin to cousin marriage or second cousin marriage is a socially accepted norm in several religions and several sectors in the society and several states. And it is definitely established by scientific facts and evaluation and study on genetics proves that consanguineous marriage or maternal uncle to niece marriage or close relation marriage is an important risk factor for the development of any health related problem, particularly glaucoma, cataract, heart problem, congenital deafness, etc. Wherever possible, this kind of marriages should be avoided or discouraged. This is a very important social issue, and consanguineous marriage is a deeply rooted custom in some of the societies, some of the states. We cannot afford to talk publicly just like that. It has to be supplemented by genetic data, genetic workup of the family, and we as individual or eye care specialist or a caregivers from the point of view of an institution cannot trust our opinion to the parents. What we can do is to give scientific information to the parents so that they are the final judge how much they should take in their understanding, in their decision making process for their life. Lot of questions were being asked. My first child is affected. If I plan for the second child, what is the possibility? There is genetic outline or genetic basis for giving answers to all of these questions, but nothing is 100%. Just because the father is having glaucoma, we cannot afford to say that the child will be having definite glaucoma. Yes, the probability of getting a child with glaucoma is more, but in a particular individual, when the child is in the mother's womb, we cannot really tell with 100% certainty. We can give information based on their genetic workup data. We can give opinion, and it is up to them how to decide. Pre-delivery evaluation, or I'll say before birth, the diagnosis of congenital glaucoma is impossible. Unlike other disease where amniocentesis, the extraction of amniotic fluid, the evaluation of that can predict the possibility of a disease, particular disease in some diseases, not all. But unlike that, congenital glaucoma is a disease where diagnosis cannot be done by that kind of approach. It is important that we evaluate the child after birth. Then only we can give the diagnosis. So that's the final message. Any questions or any queries we can?
What is the most common type in Andhra Pradesh?
The most common type of glaucoma is by birth, which is called congenital glaucoma. And while congenital glaucoma prevalence in the Western and the European countries are 1 in 10,000 to 1 in 15,000 live births, the disease is more prevalent here in southern India. Our population-based study we conducted in Andhra Pradesh called Andhra Pradesh Eye Disease Study tells us our evaluation 1 in 3,300 live births, 3,300. So the disease is about 5 to 6 times more common compared to the Western or the European statistics.
What exactly is the cause, doctor? Is it mainly consanguineous marriages?
No, not only consanguineous marriage. You know, the exact etiology, to be very frank, is not known. What is happening is there is problem or defect in the embryogenesis as the child is growing in the mother's womb. While other parts of the body is growing normally, there is some defect in the development of the eye as and when the child is developing in the mother's womb. There is some concern about infection in the pregnancy period, particularly in the first trimester of pregnancy. In the first 3 months of pregnancy, if there is any viral fever, chances of eye anomaly is very common. Particularly rubella and other influenza virus can affect the child, and the child can born with a totally deformed eye. Now, developmental glaucoma, as we see, can happen in rubella viremia if it happens in the 3rd trimester of pregnancy, and that can give rise to congenital glaucoma-like condition. But exact etiology is dependent on embryologic basis for development of the eye. As the child is growing, as the organogenesis is happening in the mother's womb for the child, for the embryo, what happens? The eye development suffers. What exactly is the cause? We do not know. Genetics play a role, probably maternal nutrition has something to do, not really an important factor, and viral infection in the first trimester of pregnancy is a contributory factor. But to be very frank, it's dependent on embryologic basis of the eye development.
So, doctor, how should a parent actually, after the child is born, how should they really understand that the child is going to get?
How the parents and the family members can know that the child is having glaucoma? You know, the answer is very obvious, as we have seen some of the photograph here. The disease is so dramatic in its presentation. I'll go to some other picture. The disease is so dramatic in its presentation that anybody in the family will be able to understand that the child is having some defect in the eye. What is that defect? To know that, you'll have to take opinion of eye care specialist. Here is the situation. Look at this child. A normal child, 3-month-old child. The child's both the eyes are normal. In fact, prominent eye. The parents thought that the child is having a beautiful eye. But that beautiful eye, as the parents appreciate, may be a manifestation of the early disease, and that can dramatically present as we see in the left eye. Dr. Anil K. Mandal, working in the LVPEI Eye Institute for last 23 years. I joined in the institute in the year 1990 and was interested in continuing my work, which I learned in the All India Institute of Medical Sciences from my professor, Professor N.N. Sood, who was the pioneer in the management of glaucoma in children in our country. I started here in the year 1990, and till date we have operated more than 1600 children with glaucoma. With this treatment strategy, I felt that education for the parents or the family members or other caregivers is very important, and that's the reason we established an informal society called Society for Children with Congenital Glaucoma, and that includes the parents, the family members, other caregivers, including the children. And formally we used to meet in once in 1 year meeting roundabout Children's Day. This year this is the 18th year meeting of the Association of Parents of Childhood Glaucoma. What we wanted to convey in this meeting is to involve the parents, the family members and the other caregivers to be involved in the care of the child in an integrated way. The best way to treat the child is to integrate the child's medical, surgical, genetic and rehabilitation measures so that each and every afflicted child gets the best possible care and each and every afflicted child becomes a contributory member of our society. The message to be conveyed to the society, and we wanted to convey to the parents here in the meeting that here is a situation which needs urgent attention, early detection, early referral, prompt evaluation and prompt microsurgical technique is required to tackle the disease. And if done properly, in most of the situation, mild to moderate variety of the disease, the child becomes alright and the vision develops and the child can study in the school for the normal children. But in severe cases, when the development of the eye is severely abnormal, we can do only limited benefit to the afflicted child by our management strategy. Whatever we can do, best we do, and later the visual evaluation is done in the Center for Sight Enhancement or Visual Rehabilitation, where if the child requires telescopic magnification, we can give that. And there are specialists working in the department who is to take care of that. We used to work in close correlation or close association with the specialist in the Center for Sight Enhancement and Visual Rehabilitation. They take care of they becomes a part of the treating team. Sometimes the visual status is such that the child cannot study in the school for the normal children. There comes the role of education of the children with the Braille system in the special school for the visually impaired. We cannot afford to tell that if the child is afflicted, if the vision is poor, we cannot afford to tell that nothing can be done. That's a great disservice to the child, to the afflicted child, to the parents, to the family, to the society. All we wanted to convey is that each and every afflicted child must be treated, if not for the eye or vision, at least for the child as a whole. And that's the message we wanted to give. Another message we wanted to give is the disease which is more prevalent in the southern few states like Andhra Pradesh, Karnataka, Kerala, etc. One of the important reasons is consanguineous marriage. By that we mean marriage within the close blood relatives, close relation like maternal uncle to niece marriage, which is a socially accepted norm in some southern Indian states, is an important contributory factor for the development of this disease. As far as possible, we'll have to develop awareness about that in the parents, in the family members, in the society, so that with adequate data and genetic workup, we can really involve the parents in the decision-making process so that in far future, consanguineous marriage or marriage within the close blood relatives can be avoided. That's a very strong message we wanted to convey. Thank you.